This final video now talking about interocclusal space problems with presence of edentulous areas. So the edentulous area has the problem, not only the teeth. So we're altering the edentulous area. So usually in these cases, there will be some grafts, alveoloplasty with sinus grafts. If it was a posterior tuberosity that has overgrown, we could add to the anterior, changing the morphology of the anterior. We could add it with combination of dental alterations. Okay, and if we have a complete denture case, so these will be a combined. For example, this is another case of combination syndrome. The posterior, I could do my alveoloplasty and bone augmentation and the sinuses. Anteriorly, I need to adjust the lower teeth and lower them. And this is a good case where we can shift to over dentures over teeth, because we have minimum amount of remaining teeth after we extract mobile teeth. And in the cases here, for example, this is a case of complete denture with limited interarch space. What are our options here? Our options here is to increase the freeway space, the vertical dimension, maintaining the freeway space as minimum as possible. Rather than going for a freeway space of 4 millimeter, I will satisfy myself with a 2 millimeter and see the patient's reaction to such reduction in the freeway space. That means I'm using an interocclusal space at freeway space of 2 millimeter, the difference between occlusion and resting position. The second alteration could be some gingival and bone surgeries, altering the ridge position. I could reshape the ridges. The third solution would be placing short teeth if the patient is satisfied with the aesthetics, and avoiding the surgeries, especially if the patient has problems with the surgery and they are contraindicated for advanced surgical procedures. But here, notice that when the teeth are very short, their binding to the acrylic is weakened. So we need extra retention for the teeth with the base plate. And there is another problem, is the occlusal force on base, because we have to place thin acrylic. We could not make the denture thick enough. We might need to strengthen it using metal. Okay, so in these cases, the base of the denture could be embedding a metal mesh to strengthen it in the areas where we have limited interarch space. Okay, so these are the solutions for edentulous problems of interarch space. If we're going to do implants, we go for procedures of accompanying implants, where we do reduction of the upper teeth, for example, overrupted upper teeth. We adjust the upper teeth, and then we go for augmenting the irregularities in the lower alveolar ridge to meet the upper teeth in the correct sphere of Monson. Thank you.